Much. The death of Robin Williams has put the national spotlight on the issue of depression. Williams struggled with addiction to drugs and alcohol as well as depression for decades before he committed suicide on Monday. Psychologist Dr. Erik joins us this morning to talk more about depression and its treatment. I think for so many people, Dr. Fisher, this is just stunning that this man who made so many people laugh and entertained so many people couldn't find that happiness inside himself.
Well, and unfortunately, that's not uncommon with comedians who often have used their comedy as a shield to protect themselves from feeling what they felt, as well as to make connections with people. And one of the things that we have to look at with Robin Williams when you talk about depression is there's a difference between what we call endogenous or more neurochemically based or genetic based depressions and more what we say exogenous or reactive depression.
And what is that? Explain what that is.
Well, a reactive depression is when somebody has life events that leads them to feeling depressed or anxious or hopeless. He grew up with parents who weren't really attentive to them. They were both professionals. They were busy. He acknowledged that the maid raised him. He also was bullied. So we have a history. We have here parenting issues, bullying issues, and we can see the long-term effects over a lifetime of how that affected somebody, and we still experience those issues in this country today that really should hopefully bring our attention to that. In his death, he had signs of that he had cut. We don't know if his cutting was a sign of somebody who had a history of cutting and was trying to relieve the pain through that, or whether it was an attempt where the knife wasn't sharp enough, which is an issue to look at there with the behavior.
Doesn't depression often go hand in hand with addiction?
It can. Men are more likely to become addicted, to deal or self-medicate their depression, and women are more likely to be identified with depression. So a lot of times we're looking at dual diagnosis between depression and or anxiety and other drug addiction issues.
You know, in national interviews, Robin Williams talked about his addiction. He didn't really talk about the depression. He said, yeah, you know, I get bummed out like most people do. There's a big difference between being clinically depressed and being, as he called it, bummed out.
Well, I think it's almost more acceptable in some ways to be an alcoholic or a drug addict than it is to say you're depressed.
Okay.
Because we see depression as a weakness, and even if you look at some of the comments that some of the people in the media said, somebody referred to him as a coward in his behavior to commit suicide, which I find ignorant, arrogant, and atrocious to say.
It's appalling, isn't it, to say something like that? Let's talk about some of the signs of depression. In retrospect, people might say, oh gosh, I wish I had known. I wish I could have helped that person. Exactly. What are some of the things we should be looking for?
You want to look for changes in behavior. A lot of times when people become depressed, they withdraw more. You look at changes in sleeping patterns. Sometimes they will sleep more, or sometimes people have early morning awakening. You also have to look at changes in appetite and issues like that. But basically, people who don't want people to know they feel depressed, sometimes you never know. Just the same way as people who are suicidal, sometimes you will never know. You might see people who have more impulsive suicidal acts that are to get attention, but when somebody really wants to commit suicide, they're going to do it, unfortunately. And it seems like in his technique, he had a way out. He shut the belt in the door. He could have opened the door. He wanted to go for whatever reason.
For whatever reason. It's so sad, you know, like I said, with so many of us just trying to wrap our minds around this genius who ended his life so suddenly. When it comes to getting treatment for depression, I also heard Robin Williams say in a national interview that, hey, you know, with his addiction, I did it on my own. I didn't go to a support group. I just kind of did it on my own.
Right.
People don't need to go it alone when it comes to depression.
No, they don't. And like I said, if everybody who with depression or anxiety talked about it and got the help they needed, there'd be much less a stigma about it because they see they're not alone and that we're not alone. Everybody goes through down times. Depression is different.
So get therapy.
Exactly. Therapy, medication is critical and important to helping people sometimes get to the low points to get better to the way they don't need it. Support groups are important. Call suicide hotlines if you feel suicidal. Another emerging treatment is called transmagnetic stimulation or transcranial magnetic stimulation, where they use low-level magnetic signals to help stimulate neurons in the brain to fire, which is less invasive or less extreme than what used to be ECT that they still use.
It is a tragedy, but
it is.
You know, on the positive side, I'm glad that we have focused our attention on what is a disease, and there is help out there for people.
And what I hope is that why people sometimes see this when somebody somebody's successful in suicide as an opportunity for them to succeed, please see it as a reason to live, because you leave people behind who experience sometimes a lifetime of their own pain from somebody's suicide.
Dr. Fisher, thank you. Appreciate your time this morning. For more information on